Good day, Maryland State Legislator. Thank you very much for allowing us to be here today. Our medical forces here in Maryland have been stretched thin, and today we are finding this is making significant impacts to the quality and availability of much-needed respite care programs, hospice care programs, and psychological care for both patients and family members. My name is Cody Kincaid. Joining me today is Ms. Loretta Kinney and Kyle Scania. Respite care is a vital resource for caregivers in Maryland. It is important that these services exist and are provided to those who need them. According to an article by Maryland Department of Human Services 2025, respite care provides caregivers with temporary breaks from the demands of caregiving to help them relax and renew, and to take care of those tasks that generally go to the wayside during caregiver responsibilities. I myself have actually had to use respite care for our daughter Josephine Lynn Kincaid. When she was 4 months old, she had to have her first open heart surgery due to a condition called Williams syndrome. At the age of 8 months old, she had to have her second due to essentially the doctors not being able to go far enough the first time. So respite care definitely took care of us and helped us get tasks done that we weren't able to do otherwise due to having to care for our daughter. Additionally, respite care can be used during the times of crisis and emergency to prevent families from being overwhelmed. A lack of respite care caregivers can result in burnout both physically and emotionally, which may affect the quality of life for both parties involved in caregiving arrangements. Respite allows for families to invest in maintaining their current situation and avoiding more drastic care measures, such as out-of-home placements of their loved ones into things like nursing homes, assisted living facilities, and rehabilitation centers. Maryland's respite system does leave families in need of assistance, though. The AARP report, Respite for All, highlights that inadequate respite services leads to higher rates of caregiver stress, depression, and physical health issues. Caregivers who lack access to consistent respite are more likely to delay their own medical care and suffer from financial difficulty due to reduction of work, hours, or job loss. These negative outcomes contribute to early institutionalization of care for recipients when family caregivers are no longer able to provide care, increasing costs to the state's overall healthcare system, and diminishing quality of life for both caregiver and care recipients. Acknowledging the broad spectrum of structural issues surrounding respite services, I ask you to make the following policy recommendations. Number 1, increase state funding. This would allow families to not feel the harsh economic impact of caring for their loved ones, or have to pick between caring for them and working. Workforce development. Number 2, workforce development. Workforce development to address provider scarcity. I cannot state this enough. We cannot care for our elderly workforce without the workforce to do so. Incentivizing healthcare positions is paramount in our efforts to provide quality healthcare statewide. Number 3, quality standards for respite service providers need to be implemented and enforced with training programs placed with yearly recertification requirements. Our policies and procedures are changing frequently, and our medical staff need to stay current on the requirements to provide the best quality of care possible. Number 4, the creation of a centralized navigation system to aid families in identifying and receiving necessary services. Navigating the healthcare system to receive respite care is an accomplishment in its own. Family members' number 1 complaint is that the administrative effort and hurdles that go into actually receiving respite care are ridiculous. A centralized navigation system can help loved ones apply for respite care, utilize government assistance and insurance benefits to help pay for those services. Again, thank you for your time with me today. I'm now going to turn over to Ms. Loretta Kinney to speak about our current situation facing hospice care systems.